A leading U.S. doctor tells CBS News the coronavirus variant, first found in the UK, is likely in all 50 states. A British scientist warns the more contagious variant could, quote, sweep the world. The U.S. now has more than 940 cases of emerging variants, including the variant first identified in the UK and two others first detected in South Africa and Brazil. The threat of emerging strains is adding a new sense of urgency in the race to vaccinate. So far, more than 68 million doses have been distributed. A little bit more than 46 million have, though, been actually administered. Across the country, several states are reporting shortages. Despite a slow rollout, Dr. Anthony Fauci says the majority of Americans could be vaccinated sometime this summer. Carter Evans reports from Los Angeles.
As vaccine demand continues to far outpace supply, tonight, a stunning prediction.
By the time we get to April, that will be what I would call open season, namely virtually everybody and anybody in any category could start to get vaccinated.
But vaccination sites still need doses. It's a big problem in Maryland.
We need more damn vaccines.
It's the same in Los Angeles.
It is a little bit of Hunger Games out there. This week, we only received 16,000 new doses. That is down 90,000 from the week before. That is unacceptable.
The shortage is forcing several LA vaccine sites to close for 2 days starting tomorrow. A site at the iconic Crenshaw Christian Center already ran out. The surrounding area includes some of LA's hardest hit communities.
It's like, oh man, I just decided that I would get the vaccine, but they're out. So,
And this is a group that's hesitant anyway.
Absolutely.
In Alabama, which ranks last in the U.S. in per capita vaccinations, all appointments with local health departments are now booked through April. 70-year-old Irene Kozad beat colon cancer and says she's desperate for the vaccine.
Disheartening. It's almost like where I thought there was hope and light at the end of the tunnel. Now I'm getting depressed about it.
Starting today, some relief as the federal government starts shipping vaccine doses directly to pharmacies. Just how far some are going to skip the line is evident in this Craigslist ad offering $100 to drive 75-year-olds to get their vaccine. You see, in Massachusetts, the drivers also get a shot. Back at Crenshaw Christian Center, the battle is now personal. 89-year-old founder Frederick Casey Price, Angie's father, is now fighting COVID.
I just called this morning to get his report, and it wasn't a good report. It's been horrible. I don't wish this on anyone.
This mass vaccination here at Dodger Stadium is capable of administering up to 12,000 shots a day. But tomorrow, this parking lot will be completely empty because at this location, there will be no vaccine left. Lana?
That is so frustrating. Carter, thank you. Infectious disease expert Dr. Amesh Adalja joins me now. He's a senior scholar at Johns Hopkins University Bloomberg School of Public Health. Dr. Adalja, thank you for joining us and for all that you do. As we just saw, the U.S. is still seeing vaccine supply issues. I remember when we were talking about how we needed to just ramp up our facilities, the ability to get these out. I'm wondering, does it seem possible that the nation will now be able to vaccinate 100 million Americans by the end of April?
I think it's still within the realm of possibility. We are doing around 1 million doses a day, give or take. So that's something I think we will achieve, but I think that's still not fast enough, especially as these new variants are spreading in the United States. We basically have a race between us and the vaccine, us and those variants. And I think we're gonna lose if we don't pick up the pace, if we don't figure out these bottlenecks and all the logistical difficulties that we're seeing.
That's exactly what I think is so concerning to people. More than 68 million vaccine doses have been delivered to states, but only about 46 million have been actually administered. So what's happening to those extra 20 million or so doses? Are they being kept in freezers? What is going on?
It's really unclear to me, and I think it's kind of a little bit baffling that we have vaccines sitting on the shelf. Some states may be unsure if they're going to get second doses, so they're holding back their supply to make sure that they can give the second dose to people who got their first dose. Others may not have the ability to actually push that vaccine out to vaccine centers. So, for example, if they're having mass vaccination sites or health departments at a county level, there's a lot of opacity in what's going on with that supply. So we have the State Department of Health complaining about the federal department, the federal roll out, and then we have the county departments of health complaining about the state. So this kind of cascading failure that we're seeing is really unacceptable and has to be fixed. And it's very reminiscent about what happened during the 2009 H1N1 pandemic.
So it sounds like you're a bit frustrated by it. I know that our viewers and all of us who have been patient and we're looking towards these vaccines and see these strains coming, these new variants, with trepidation, are frustrated by it. But Dr. Anthony Fauci said that April might be the time that doses are available to everyone. Why is he optimistic right now? And can you go ahead and remind us how much of the population needs to be vaccinated for us to return to a sense of normalcy?
Dr. Fauci is optimistic because we're seeing all of these deals be struck for the supply. And most of us assume that we'll get this right eventually, that we'll be able to vaccinate at a much faster clip, especially when the Johnson & Johnson vaccine, which is only a single-dose vaccine, doesn't require all of that cold storage issues, is available, that things can go a lot quicker. What we're thinking about with herd immunity, though, is about 70 to 80% of the population to get vaccinated before we get, aggressive amount of control on this virus. However, we will see benefits once we get our vulnerable populations vaccinated so that we don't see hospital capacity being a concern anymore once nursing home residents and community dwelling elderly are vaccinated. So we may start to see restrictions being lifted as that vulnerable population becomes protected from severe disease, hospitalization, and death.
And in the meantime, the director of the UK's genetic surveillance program says that the coronavirus variant that was first identified there is going to, quote, sweep the world. This sounds horrific. I mean, this sounds like another wave of the pandemic. Is he overstating the case? Do you agree?
I do think that the UK variant, the 117 variant, is more transmissible. So simply by Darwinian principles of evolution, this is going to become the new strain, or the strain that most people get infected with going forward. The good thing about the UK strain is, although it's more contagious, our vaccines seem to work well against it. It doesn't seem to be more deadly. We have to be meticulous about our common sense precautions with it, but the vaccine is the solution to the UK strain. So that really just puts more emphasis on the fact that we have to move forward with this vaccine with no speed limit, as quick as we can.
One last question for you. Early trial results show anti-inflammatory drugs used for rheumatoid arthritis appear to reduce the risk of death in severe coronavirus cases. Can you explain to us again, because it seems like we've talked more about vaccines recently and less about treatments, but how inflammation is linked to COVID-19 and how promising a development this is?
So you have to remember that any infectious disease is an interaction between you, the person that's getting infected, and the virus. And it's your immune system that sets off an inflammatory response that not only fights the virus, but also causes a lot of collateral damage. And we've seen that be very dramatic with COVID-19, these cytokine storms where your immune system is releasing all kinds of chemicals that control the virus, but also hurt your lungs, hurt your organ systems. And what we've seen with dexamethasone and now with tocilizumab, which is this other drug that is used for rheumatoid arthritis, is that it does look like it can improve mortality if you give it to people when they're in the hospital. So this will be another tool that we'll use to drive hospital death rates down. And we've been doing better through this pandemic. It's much better now to get COVID-19 and end up in a hospital than it would have been a year ago when we didn't have any tools. So this is a welcome tool. And I think you'll start to see it be used much more frequently in hospitalized patients. And we'll start to get the rate of death down in the ICU even more than what it is now.
I guess I just have to ask one follow-up question before I start to get too excited about this. Is this a medicine, a drug that is widely available, that exists in hospitals across the country, that there are no shortage problems for currently?
We haven't seen shortages with it yet, but there is probably going to be increased demand now with this new trial and the protocols being changed in hospitals. So we may have to make sure that supply chain is intact. But this isn't a knockout punch. It's marginal on top of dexamethasone. Dexamethasone is still the workhorse that we're using in patients that are hospitalized requiring oxygen. So this is an added benefit. And I think it's going to take some time before we see exactly what this translates to, because some of these studies were done in Europe, in the UK, where the mortality rate is a little bit higher in the ICU. So it's going to take some time for this to make its way through the guidelines, but we want to make sure that this is available in this country to doctors who want to prescribe it to their patients.
All right, Dr. Amesh Adalja, thank you.
Thank you.